So, been called to a 14-year-old boy who has hit a rock and fallen off his bike and has injured his knee. So his chief complaint is injured knee. When we arrived, we have assessed his ABCs. They were all fine. He was wearing a helmet, and we did ask simple neurological questions, such as if he did have a headache, if his history of epilepsy, or if he was. There were no bystanders around, so we couldn't really ask if he was having seizure-like movements. However, there were no alarms raised to straight away do a neurological assessment. So we primarily focused on the musculoskeletal assessment as our first assessment, and then we moved to do a neurological assessment just to make sure that it wasn't a medical event that caused this accident. His vitals were... So his primary complaint is his knee, so he has fallen off his bike. He was wearing a helmet, and he says he didn't hit his head. And the only thing that he has injured is his knee. So first of all, taken off his shoes and socks to be able to compare the limbs. And we're just inspecting the knee. I can't see any obvious deformities. His legs are the same size. One's not shortened or is longer than the other. I don't see any immediate swelling. If there was immediate swelling 10 minutes after, it would be indicative of hematomas, which is blood inside the cavity. There's none of that going on. So I've just inspected the knee. Now I'm going to use the 6 P's of the musculoskeletal system. So first I'm just going to see the pain. So Matthew, can you tell me where the pain is?
Everywhere.
Everywhere on your knee. Is there pain up here? Okay, is there pain down here? Okay. So there's pain up here. Are you able to move the knee up? And was it painful when you did that? And on a pain score of 0 to 10, 10 being the worst, what's your pain like? A 3? Okay. So now I'm just going to assess for Taylor. So I'm just feeling his knees. They both feel the same temperature. I don't see a limb. It's not becoming ischemic. It's not going blue in any way. Which I just want to make sure that his limb isn't compromised. But they're the same colour and they feel the same walk, which is good. I'm just going to assess his capillary refill time. It's 2 seconds, and that's 2 seconds as well, so that's all good. And then I'm just going to assess his pulses, so I'm just going to do his pulses behind his knees. And they're strong and regular. And I'm going to do his pedal pulses as well. Yeah, and they're strong and regular too. Next is paresthesia. So, Matthew, are you able to wiggle your toes for me? Yeah, so I can see you can wiggle his toes. And can you feel me? Yeah. Yeah. That's a sensation everywhere, so no neurovascular system is compromised in his legs. Now I'm just going to assess the Ottawa knee rule, and that's just looking to see if he needs an x-ray or if it's possibly fractured. So Matthew is 14 years old, so he's not older than 55. Matthew, do you have isolated knee pain, patellar knee pain here? Is that a no?
It's a no.
Okay. And do you have fibular pain just here? No. Now I'm just going to see if we can bend your leg to 90 degrees for me. And if there's too much pain, just let me know, okay? Oh, awesome. So he can bend his leg to 90 degrees. And then finally, we're just going to see if he can wait there more than 4 steps on it. So Matthew, let me know if you're in too much pain, but we're going to try and get you up and see if you can walk, okay? I'll help you up. Okay, can you walk? Turn around and go back. Yeah, so he can wait there. Yeah, and just sit down again. So now that we've kind of excluded I'm not thinking it's a fracture at all, I'm just thinking it's a soft sprain or a ligament injury. So now we're going to do the patellar apprehension test. So we'll just move your knee about 30 degrees. And I'm just looking, this is just to see if there's possibly a subluxed injury, patellar dislocation. So I'm just going to move the knee laterally, and I'm just going to see if his quadricep contracts at all, and if there's a grimace in his face, which is indicative of a subluxed injury. So I'm just going to move his patella laterally. Does that hurt at all, Matthew? Okay, so I didn't see a grimace, and I didn't see his quadricep contract, so that's all good. Next I'm going to do is the dimple check. So I'm just going to put your leg down. So medially there's a nice contour, there's a nice dimple medially inside his leg. So I'm just going to push the knee laterally and medially just to see if there's a fluid shift, which is indicative of swelling. It means there's fusion going on. So I'm just going to do that. But I can see that has maintained the nice dimple. So there's not any swelling going on behind the kneecap or in the knee. Next I'm going to do is the patellar tap, and I'm just listening for any hyporesonance or a fluid wave-like motion shift of the fluid around his knee. So Matthew, I'm just going to tap your patella a few times. Is that okay? Alright. Okay, so I didn't see any fluid shift behind the knee. Next I'm going to do the collateral ligament test. So I'm just testing his medial and lateral ligaments. So what I'm going to do, Matthew, I'm just going to raise your leg. I'm just going to see, I'm looking for movement more than 3 millimeters. So I'm just going to move his knee medially and his ankle laterally. Does that hurt at all, Matthew? Okay. And I'm just going to do the other way as well. Okay. So I didn't feel any more than 3 millimeters of movement, and it wasn't painful for him. Next we're going to do the collateral ligament draw test. That's testing his anterior and posterior ligaments. So what I'm going to do is I'm just going to rest my leg on your foot so you don't go anywhere, and I'm just going to place my hands on his patella, and I'm just going to try and bring his tibia forward and see if that moves. Okay, and that doesn't move, and I'm looking for more than 6 millimeters of movement. Now I'm just going to check his posterior crucial ligament, so I'm going to pull the tibia back. Okay, and I don't feel any movement there. Matthew, is that painful at all? Okay. Next test that we're going to do is the McMurray's test, and that's just looking for any meniscus damage. So what I'm going to do is his leg's bent, and we're just going to push the kneecap in medially and see, I'm just looking for any grimace on his face, if I can feel a locking or hear any clicking. Alright, so Matthew, just let me know if this hurts at all. Okay, we'll do it again. We can do this a few times, but I'm not hearing anything and I'm not feeling like a locking sensation. Was that painful at all? Okay, now, last of all, should have done this a bit earlier, but just checking his range of movement is the same between both his legs. So Matthew, we're just going to extend your leg. Any pain? Okay. Okay, and then we're just going to go around the circles. Okay, and then the other way. Okay, how does that feel? Good. Okay, now we're just going to do the other knee. Okay, so extend it right up and out, and around the circles. Okay, and the other way. Okay, so range of movement feels the same in both his legs, which is good. So I'm just thinking it's a soft tissue injury, so with that, my advice for him would be right, so to rest, bicep compression and elevate it. And if it does get worse or he is in more pain, to maybe go see a GP. Next, I'm going to do a neurological assessment on Matthew. He was wearing a helmet, and he states that he didn't hit his head, but we just can't rule out at the moment that it wasn't a medical event that caused him to fall off his bike and hurt his knee. So he did tell me he hit a rock, and that was the reason why he fell off his bike. But we're just going to do a few neurological tests to make sure that there wasn't anything else neurological going on. So, Matthew, you remember the whole event?
Yes.
And so why did you come off your bike? There was a rock. Okay. And are you feeling dizzy at all? Feeling nauseous? And do you have any blurred vision? No? Okay, so I'm just going to check his pupils out. So, Matthew, if you can just look at my finger, and I'm just going to shine a light across your eyes. Okay, so his pupils are equal and reactive to light, which is what we want. Now I'm just going to perform a fast test. So this is just ruling out stroke, possible stroke or stroke-like symptoms. So Matthew, can you look at me and give me a big smile? I don't see any unilateral weakness. He has good motor control over his face. So he's producing a nice even smile, which is what we're after. Next, I'm just going to assess his strength in his arms. So Matthew, can you put your arms out like this? Yeah, palms up. And can you just close your eyes and hold your hands out, please? So I'm just looking to see if one arm droops, but it doesn't. So thanks, Matthew. And I'm just looking for that kind of one-sided weakness. Matthew, can you put your arms out again? Okay, and can you just squeeze my hands and pull me in? pull me out? Okay, so all those motor movements were really controlled. He had even control of his movements and good motor strength, which is what we're after. Now I'm just going to test his cognitive speech. So I'm looking for any slurred speech. So Matthew, can you tell me what day it is today? Thursday. And do you know where you are at the moment?
New Zealand.
Okay, and what's this?
A bike.
Cool. So he's able to recall what's happened, and so he's orientated to time and place, and I didn't hear any slurred speech at all, so that's all good. Next I'm going to do another coordination test. So Matthew, can you please, what I'm going to do is I want you to touch your nose, and then touch my finger, and then touch your nose again. Okay, yeah, touch my finger, touch your nose, touch my finger, touch your nose, touch my finger, and touch your nose. Okay, now the other hand. I want you to touch your nose and touch my finger. Touch my nose. Yeah, perfect. So yeah, good coordination there. The next test I'm going to do is I just want to see him walk and that he has good control over his balance and things like that. So Matthew, if we can get you up, I just want to see you walking. Okay, just walk for me. Okay, he has a nice normal gait, which is what we're after. If he didn't have any neurological issues going on there, he remembers everything, so I'm not thinking it was a medical event that caused him to fall over, and that it simply was he did hit a rock, which caused him to fall off his bike.